Hi, I'm Gianna, and this is my research project proposal. My research question is, will implementing an advance notice antecedent intervention procedure utilizing a supplemental visual schedule decrease transition-related tantrum behavior in children diagnosed with autism spectrum disorder when transitioning from their vehicle into the applied behavior analysis treatment clinic? In past research, focused mainly on transitions within a classroom, and they didn't really address any larger scale transitions or transitions from one setting to another setting, and I thought that that was a limitation in the research, and I wanted to expand upon the past research and using the methods that they used, which I found that advance notice antecedent interventions were some of the most commonly used interventions. So Brewer et al. In 2014 did a literature review examining the effects of advance notice procedures on transition-related problem behavior. And advance notice is just any procedure that is used to signal an upcoming transition, to increase predictability and reduce uncertainty regarding the upcoming transition. Brewer et al.'s research yielded mixed results about whether the advance notice procedure was effective in decreasing the problem behavior in each of the studies that he reviewed. However, he did find that advance notice procedures were effective in decreasing the problem behavior or the target behavior if it was maintained by negative reinforcement. So, in my study, I made sure to conduct a functional analysis, and each of my 6 participants, their transition-related tantrum behavior was maintained by negative reinforcement and an escape function. My research consists of 6 participants, 3 girls, 3 boys, ages 4, 5, and 6, 2 4-year-olds, 2 5-year-olds, 2 6-year-olds. 3 of the clients or participants arrive at the clinic where the research is going to be taking place in their parents' car, and 3 of them arrive off of the bus after school. I just wanted to account for both, or means of transportation and arriving at the clinic, and also because I have experienced clients who engage in tantrum behavior during transitions from both the school bus and their parents' car. And this is a particularly socially significant issue because at my clinic, we are not allowed to assist in getting the individuals out of the car or off of the bus. We are only allowed to meet them and walk them into the clinic. So it ends up taking a while sometimes to transition, which in an ABA clinic setting, session times are typically fixed, and there is a certain block of time. And especially for the children who come off of the bus after school, they only have a 2 or 3 hour session, and if we spend half an hour, 40 minutes during transition, and then subsequent de-escalation from the tantrum episode during the transition, we are losing time that we can be spending on treatment, which ultimately decreases the effectiveness of the ABA treatment. So I found a statistic from Senato and Lyon in 1983. They found that typical preschool children spend 20 to 35% of their class time transitioning from one activity to another. And in a classroom setting, time that is spent in transition alone typically surpasses the amount of time that the students actually spend actively engaging in learning and academic responding. So for children with autism spectrum disorder who engage in problem behaviors such as tantrums during transitions, the percentage of time that is spent in transition is increased even more because of the time it takes to transition and then de-escalate from the tantrum behavior. And if we're looking at a 2 or 3 hour session time, that's like a quarter of the time being spent in transition, which ultimately is going to decrease the effectiveness of the ABA treatment. So the goal of my research was to fill a gap in the literature because it specifically targets tantrum behavior during transitions from the participant's vehicle into the ABA clinic setting in children diagnosed with autism spectrum disorder who receive clinic-based ABA services. In the intervention condition, a visual transition schedule was provided to each participant that was kept in their parents' vehicle for those who arrived in their parents' vehicle, or clipped inside of the backpacks of the individuals who arrived on the school bus. The visual transition schedule consisted of picture icons in a task analytic checklist format. The images depict cartoon individuals engaging in the behaviors in each step of the task analysis, with the step written in a small font under the photo. Arrows pointed from each picture icon toward the next step of the behavior chain to make it easy to understand for the participants who were unable to read the task description. Participants used the visual transition schedule to assist them during the transition from the vehicle into the clinic during intervention conditions. Upon greeting the therapist after exiting the vehicle, which is step 4 in the task analysis that the observers have on their tablets, the therapist will then attach between 1 and 3 additional picture icons out of a variety of individualized picture icons with Velcro on them based on programs within the participant's behavior plan. These additional icons that are attached to the schedule by the therapist upon completion of step 4 of the task analysis, which is exiting the vehicle, provide the participant with advance notice about the activities or programs that are set to occur after transitioning into the client and unpacking during their session, transition into the clinic. The additional icons will be shuffled and different from the previous day, and we expect that participants develop an establishing operation for the additional icons due to their novelty each day and the additional predictability and structure it provides them. The additional icons provided by the therapist also acted as additional reinforcement for exiting the vehicle. Once the participant exits the vehicle and approaches the therapist, the participant's behavior is reinforced with the additional Velcro activity icons that give the participant information or advance notice regarding the activities to expect once they get into the clinic and the session begins. Compliant behavior is reinforced with additional predictability, so we expect to see compliant behavior increase with the use of the additional activity icons. Beginning on a Tuesday, all 6 participants utilized the visual transition schedule during their transition from the vehicle into the clinic. Observers started their stopwatches when the therapist walked up to the participant's vehicle and took data on BibTrack on their tablets in the same manner as they did in the baseline condition, following the therapist as if they were shadowing them. The observers took data on the same task analysis and on the same target behaviors as in baseline conditions. The only difference was that the participants were encouraged to reference their visual transition schedule throughout the transition process in the intervention condition. The results of this study showed an overall decrease in the occurrence of transition-related tantrum behavior across all individuals after the implementation of the visual activity or visual transition schedule. The 3 individuals who transitioned from a school bus into the clinic setting had a greater decrease in tantrum behavior of 85% than the 3 individuals who transitioned from their parents' car into the clinic setting, which was 65% decrease. Of the individuals whose tantrum behavior persisted post-intervention, the duration of tantrums decreased by an average of 70%, and 2 individuals, both transitioned from the school bus, did not engage in transition-related tantrum behavior after intervention conditions. The research provides evidence for the effectiveness of a visual activity schedule in decreasing transition-related tantrum behavior during the vehicle to clinic transitions. The visual activity or the visual transition schedule procedure was shown to decrease overall transition times across all participants and ultimately increase the time spent in therapy, which maximized the overall effectiveness of the participants' ABA treatment.